Good afternoon, guys. We're gonna be discussing for discussion a cognitive and mental health behavioral therapy for today's discussion A. So here we go. Explanation of cognitive and mental health behavioral therapy, especially as it intersects with clinical practice, community engagement, and culturally responsive frameworks. Core concepts, what it encompasses. Cognitive and mental health behavioral therapy is not a single modality, but rather a constellation of therapeutic strategies that target the interplay between thoughts, emotions, and campaigns, which build with built-in myth-busting stigma reduction features. Evaluates cultural adaptations using mixed methods approaches, mapping how cognitive restructuring and behavioral activation resonates across different belief systems, languages, and lived experiences. Supports infrastructure development by embedding behavioral health strategies into broader aging and wellness initiatives like transportation access, housing stability, or telehealth equality. If the page was focused on toolkit development, given your expertise in co-designing culturally adaptive innovations, the phrase might be embedded in a framework that translates CBT principles into modular prompts for life review, grief processing, or intergenerational dialogue, especially for rural African American elders or other underserved groups. Incorporating behavioral therapy into digital outreach tools such as caregiver apps or community health behavior prompt or behaviors to promote psychological well-being. It draws a it draws heavily from cognitive behavior therapy, a gold standard apparently supported approach that helps individuals recognize disordered distorted thinking, challenge multi maladaptive beliefs, and adopt healthier behavioral patterns. Behavioral therapy techniques. These include exposure therapy for phobias and trauma behavioral activation for depression and habit reversal for compulsive behaviors. Mental health interventions, often layered with mindfulness practices. Emotion regulation strategies, psychoeducation, and motivational interviewing to support holistic recovery. This therapeutic umbrella is designed to be flexible, allowing for adaptation across diverse populations and settings, from clinical offices to community centers, from individual therapy to group based interventions. Application across settings. Depending on the contexts, this term may be used to describe interventions in clinical mental health treatment, addressing conditions like anxiety, depression, PTSD, OCD, schizophrenia, and bipolar disorder. CBT and behavioral therapies are often first line treatments due to their structured nature and measurable outcomes. Cognitive health and aging, supporting older adults experiencing memory loss, mild cognitive impairment, or dementia techniques may include cognitive stimulation, reminiscent therapy, and behavioral strategies to manage aggression or confusion. Trauma informed care, especially especially relevant in marginalized communities where behavioral therapy is adapted. To address intergenerational trauma, systematic stressors, and culturally specific expressions of distress. Caregiver support and education, providing caregivers with tools to manage their own stress under behavioral symptoms, loved ones, and and apply therapeutic techniques in daily interactions. Community-based programs. These often integrate behavioral therapy into culturally tailored outreach using local idioms, storytelling, and participatory design to foster trust and engagement. If you're working on specific toolkit, campaign, or intervention model, I'd be thrilled to help you integrate behavioral therapy components in a way that both evidence-based and culturally attuned. Just let me know the population or challenge you're targeting, and we can co-create something powerful. Okay, guys, so that is A for you. I will be back on with B shortly. So I will see everybody shortly for B. For now, Gator Wellness, take care, folks.